Good morning, good morning, good morning. I'm Dr. Dale Dangleben, and on behalf of Patient Choice in Shimenef, Point Michelle, this is the medical tidbit of the day. I'm keeping it in terms of the surgical things, the things that I've done through the years. I've done hundreds to thousands of these. Today, I want to talk about umbilical hernia. And umbilical hernia is interesting because when we were growing up in the Caribbean, many people had large umbilical hernias, but no one knew what they were, right? And to this point, I still don't think some people understand what umbilical hernia is. An umbilical hernia occurs when tissue, right, either fat or your intestine, pushes through a weak spot around your belly button, your umbilicus, right? Does the term umbilical hernia. And this creates a visible or palpable bulge, right, that may become noticeable with coughing, right? Straining, if you take having a bowel movement, heavy lifting, or even just standing, right? Now, umbilical hernias can occur in infants, children, and adults, right? But the management is different based on your age, right? Because 90% of pediatrics, meaning children hernias, will resolve before the age of, around the age of 3, but typically at around age 4 to 5. So that means 10% will persist beyond that, that will require surgical management, right? So let's talk about infants and children. It's very common in newborns, right? Especially premature babies, right? More frequent in infants with low weight, right? So it occurs when the umbilical ring does not fully close after birth, right? Or the umbilical cord. So think about that, right? But most pediatric umbilical hernias, like I stated before, will resolve, close on their own, and is harmless in that age group. Umbilical hernias in adults usually results from increased pressure inside your abdomen, right? That in combination with a weak abdominal wall will cause an umbilical hernia. So what are some of the risk factors? Obesity, right? Pregnancy, especially if you've had multiple pregnancy, weakens the abdominal wall, right? Chronic coughing in smokers, people with chronic obstructive pulmonary disease (COPD), people with ascites, which is fluid in the abdomen, and that is a special case in of itself for a separate time, right? Heavy lifting or straining weightlifters and things like that. Anyone who's had prior abdominal surgery, okay, and elderly patients, right, with tissue weakening. All right. So remember that in adults, umbilical hernias do not heal themselves. They do not heal on their own. All right. So remember that you have to consult with your doc, especially a surgeon. So what are the signs and symptoms? You have a soft bulge at or near the belly button, right? Sometimes you can have discomfort or pain, especially on exertion, all right? In severe cases where a knuckle of bowel or a large piece of fat is stuck in there, you can develop nausea, vomiting, severe pain, redness, firmness, and things like that. That becomes more of an urgency, right? So emergency signs include a bulge that becomes so hard and extremely painful, and then you have some discoloration, and you cannot push it back in, right? This indicates what we call in the surgical world incarceration or strangulation. Incarceration means that it went in and it's stuck. Strangulation means that it's now compromised the blood supply and it's dying. Okay, so that is, I think, a surgical emergency, and that really changes the outcome in terms of the type of repair you do. Okay, and also the risk of infection and complications and things like that. All right, so remember. So who should get the umbilical hernias repaired? Remember, I said in children, most close spontaneously by age 3 to 5. So don't be bothering at age of 2, 3. Don't Let your doctor take note of it. You take note of it, right? By the age of 5, right? When beyond the ages of 4 and 5, then you start thinking this needs to be repaired. And I'm telling that to the surgeons also. Okay? Any very large hernias that's causing pain, any incarcerated or strangulated hernias should be dealt with surgically. All right. So how do you repair these hernias? Again, like I've said, I've done a lot of these. I've done these open. I've done them laparoscopic. I've done with mesh, without mesh. All right. Typically, what we would do is what's called an infra-umbilical incision. All right. And again, it depends if you have if you want an innie, outie on all these things, but that's cosmetic. A small incision near the belly button, right? We get in there, get the hernia contents, we push it back into the abdomen, and then the defect, the hole that's there has to be closed. Okay? If it's about 2 centimeters, we typically just put stitches in there, right? It's called pants over vest technique that I was taught. But if it's larger than that, then you put a piece of mesh, right? A special mesh now for the umbilical hernia. And again, that requires surgical technique, all right? I would say for larger umbilical hernias, laparoscopic is the way to go. You see the inside, you pull everything down, you see the defect, you put your mesh in, and you tack it down, right? So there's a lot that goes with the surgical aspect of it that surgeons have to understand, right? So the small defects, 1 to 2 centimeters, primary closure without mesh, large defects, mesh, laparoscopic, otherwise, okay? So these are the kind of things that you have to understand about umbilical hernias. But with every surgery, everything like this, there's risk. There's risk of infection. There's risk of bleeding, right? There's risk of what's called seroma with any hernia. Seroma is a fluid collection, especially in that pocket that was there before where the mass was in, right? And chronic pain but again, it's a small subset of patients that get that. And you can have mesh-related complications. We know there's a lot of talk about this and that about mesh, but with any procedure, the complication rate is not 0. All right. So again, I just wanted to put this out there in terms of what can be done. When I used to do umbilical hernias, I don't do as much because I'm more into the trauma and administrative side of things. But the first 15 years, I did a lot of hernias. Most patients go home the same day. That's the same day surgery, right? And it's really mild to moderate pain is expected. All right. So again, I just wanted to put that out there as the topic of the day, right? But I am appealing to the physicians to make the proper diagnosis, and the surgeon, and refer to the surgeons, and you, the surgeons, you do the right things. In the adults, it doesn't close. Now, if the patient has ascites, I said, no, you have to be careful in terms of repairing that, especially if they have cirrhosis of the liver. That's another topic for another time. Have a great day. I'm out. Peace.